Hi, my name is Nicholas Cohen. I'm a primary care doctor with a practice in downtown San Francisco. I created Health Score. Health Score is a comprehensive program to optimize health and extend life. In my over 10 years of practice, I've been able to help improve the health and support longer lifespans for thousands of patients. Now, Health Score is available to the general public, to anyone who wants to optimize their health and extend their life. Health Score is based on 31 recommendations that cover 4 domains: psychological health, sleep and activity, nutrition, and your numbers or biometrics. Today, we're focused in the domain of psychological health, and we're talking specifically about the recommendation for social connection. This is recommendation number 8, connect with others. In the previous lecture, we discussed loneliness. Loneliness is different from social isolation. Loneliness is subjective. Loneliness is the feeling of not having the intimacy in your social connections that you desire. For loneliness, it doesn't matter how many social connections you have. You could have plenty of friends and family you relate to on a regular basis, but still feel lonely. Social isolation is different. Social isolation is an objective state of not having several friends and family you connect with regularly. In general, social isolation means you don't have friends or family you regularly hear from, talk to, and call on for support. But social scientists have become more precise in defining social isolation and the degree to which someone is socially connected. It's called the Lubin Social Network Scale 6. There are 6 questions. First 3 cover family, second 3 cover friendships. I recommend you pause the video to assess your own score. For family, considering the people to whom you're related by birth, marriage, adoption, etc., how many relatives do you see or hear from at least once a month? None, 1, 2, 3 or 4, 5 through 8, 9 or above. Select the response appropriate for you. Number 2, how many relatives do you feel at ease with that you can talk to about private matters? And that's also none, 1, 2, 3 or 4, 5 through 8, or 9 or above. 3, how many relatives do you feel close to such that you could call on them for help? None, 1, 2, 3 or 4, 5 through 8, 9 or more. So mark the appropriate response for you, and you can total up your score. It should be somewhere between 0 and 15. Let's move on to the friendship domain. Considering all of your friends, including those who live in your neighborhood, how many friends do you, 1, see or hear from at least once a month? Answer is none, 1, 2, 3 or 4, 5 through 8, 9 or more. How many friends do you feel at ease with that you could talk about private matters? None, 1, 2, 3 or 4, 5 through 8, or 9 or more. And finally, how many friends do you feel close to such that you could call on them for help? None, 1, 2, 3 or 4, 5 through 8, or 9 or more. It may be a little confusing. The number in the boxes corresponds to the point score, not the number of relatives or friends. The top line, the none to 9 or more, is the number of contacts. So you should have a score somewhere between 0 and 30. That's your social isolation score. And you can interpret that as follows. If your score is 12 or less, you're at risk for social isolation. Otherwise, you're not. And here's a reference to the journal article for further reading about this assessment tool. So you have some idea now where you fall in the severity of social isolation or the degree to which you're socially connected. What is the evidence that this has anything to do with health? Here's the evidence showing the connection between social isolation and health outcomes. This is the study. It was published in the Perspectives on Psychological Science. It was a systematic review and meta-analysis published in 2015. Over 3 million adults were included in the review, and the average follow-up period for the studies included was 7.1 years. The outcome of interest was, does social isolation result in increased risk of death? And the investigators found that indeed, during the 7-year follow-up period, people who were determined to be socially isolated had a 29% increased risk of dying during that follow-up period compared to people who were socially connected. Once again, to remind you of the interpretation of the score, a score of 12 or less would be considered at risk for social isolation, and there was a 29% increased risk of premature death during the study follow-up period. But how exactly does social isolation lead to health problems? Well, social isolation is connected with two pathways that can lead to poor health outcomes and premature death. One is through behaviors. So this is the indirect pathway. People who are socially isolated are more likely to smoke, to be physically inactive, and to get insufficient sleep compared to those who are socially connected. Also, there's a direct pathway through physiologic processes. Specifically, the following biological markers are also elevated or abnormal in people who are socially isolated. There's increased blood pressure, increased C-reactive protein, which is a marker of inflammation, and inflammation is implicated in many processes with aging. High cholesterol levels, which puts people at risk for increased risk of cardiovascular disease, and poor immune function, which makes people more likely to be susceptible to illness and have a harder time recovering if they do get sick. We've discussed what it actually means to be socially isolated and what the evidence is for the health consequences, but the question remains, is there anything you can do about it? The answer is yes. Fortunately, there are several ways to address social isolation. A lot of the same recommendations I shared with you for loneliness apply to social isolation. If you follow the evidence from clinical trials, the most effective way of treating social isolation is addressing the beliefs of people who remain socially isolated. The technique to intervene is called cognitive behavioral therapy. The theory is that people who remain isolated actually do so not because they don't have opportunities to connect, and not because they lack the social skills necessary to make connections, but because they have beliefs or predictions about what interactions with others will be like that lead them to avoid making the attempt at connection. With a trained therapist, you can uncover what your predictions or beliefs are about your interactions with other people. You can test those ideas by reaching out and trying to connect and seeing what results. And usually this leads to you being able to identify what are called cognitive distortions or patterns of thinking that don't actually bear out when you test them. These are predictions about others that are negative, or predictions about what will happen in your interactions with others that are pessimistic. You can find a cognitive behavioral therapist through your healthcare insurance website, which will allow you to identify providers who are covered in network. You can also find reviews of therapists that have been seen by my patients recently using the resource section in this program. There I provide this link of therapists who have been reviewed recently by patients who I see. Many of these therapists are based in San Francisco, but many also are doing telehealth visits now, so you may be able to connect with them even if you don't live in San Francisco. The other way of improving social isolation is more pragmatic, and there's less evidence in the literature for this, but I personally have found it helpful, so I'm sharing it with you. During shelter in place, there's a lot of limitation on the time we can spend in person with each other. Many of my patients who report good social connection have maintained the regular contacts they have with friends and family, but do so online now rather than in person. There are also social groups you can join where you share a common hobby or interest, like Facebook groups or meetups. And finally, there are even dating apps, which can be a good way of finding romantic connections. And these can lead to dates that are done by video or phone. They're not necessarily all in person, and that's becoming very popular right now. Whatever technique you adopt, what I would suggest you do is you make it a habit. Rather than put too much expectation on how one attempt at any of these things will work, schedule a 30 minutes a day of looking online for local groups to connect with, or 30 minutes a day of looking at a dating app. But if you make it a habit and don't give up if you have initial challenges, then it's something that is likely to bear fruit with persistence. And lastly, there are no frequently asked questions for this topic. In summary, we talked about recommendation number 8, connect with others. I described what it means to be socially connected, and you have a scale you can use to determine your own degree of social connectedness. We talked about the evidence of health outcomes and the mechanism whereby health is affected by social connection and social isolation. I shared with you some tips for addressing self-isolation, and which include therapy as well as online apps and online meeting platforms. I hope these recommendations help. I hope you're able to feel more connected, and I appreciate your time and attention. Thank you.